Q, your favorite gynecologist, and we are back at it discussing topics that affect you, informing you, and empowering you. I believe that informed patients are empowered patients. So today, I just want us to break down just a bit this topic of age-related infertility. What really is going on, and what is it really about, and what do you need to be aware of? Sometimes, you find that you're dating somebody, there's an age difference, or maybe men are not even aware of the fact that there is such a thing as a biological clock, or we don't have all the time in the world to take the time that we need or that we would like to delay baby making or starting a family or growing a family as we would wish. So sometimes we find ourselves that you're under pressure now and you don't know what are the time frames, how much time do I have, or what options do I have. So today I just want us to quickly discuss what is age-related fertility and what does it mean for women. So it is important to know that women are born with a fixed number of eggs. Unlike men produce sperm on a daily basis. But with women, they are born with a fixed number and there is natural egg death. Every day, a woman loses about 30 eggs every day, about 1,000 eggs every month on average. These are average numbers. So a woman begins naturally with being made in the womb. When they are created, there is about 5-6 million eggs, plenty, that women are made or formed with already in their mother's womb. So by the time we are born, already from about 5 million, it's a serious decline to 1 to 2 million eggs by the time of birth. Now, as the woman grows, by the time they reach puberty, which is an average age of about 12 years, women are mostly left with about 500,000 eggs. Remember, made with millions, born with 1 to 2 million, already by the age of 12. So women, don't blame yourselves. Already by the age of 12, we're sitting at plus minus 500,000 eggs that are left. And remember, we are menstruating every month. You go through those pains, you see that red, and it's happening. Know that plus minus 1,000 eggs are lost with every period. Now, what happens as we age? By the time women reach the age of 32, we are looking already at plus minus 120,000 eggs that are left in both ovaries. And mind you, between the ages of 18 and 32, maybe let's take it to even 35, those are the best ages for fertility. So unfortunately, you find that by the ages of 18, hey, we are still doing our matric, we're looking forward to going into varsity, and we do varsity for 3 to 5 years, 3 to 6 years, depending what course you're doing. And then when you're done with varsity, who still wants to make babies? A few women do. But the majority then of women, those who are career orientated, will then want to still take their time and start working, climb the career ladder or the corporate ladder, and get the best out of themselves, empower themselves further, get financial independence. They want to tick all the boxes, get the car, get the cab, get the townhouse, whatever it is, and then get the knight in shining armor before you can even think baby making or starting a family. By that time, we are how old? We're talking something like 31, others 35. Maybe you don't even find the prince in shining armor by the age of 35, 37. What happens then? So this is where there is a severe decline in fertility. We are looking at ages 35 going forward. There is a drastic death of eggs in the ovary, fertility decline, and women above the ages of 37 are already left with under 25,000 eggs. in the ovary. And still, the natural death happens every day and every month. So this now is where women need to gauge. Mostly from the ages of 40, it's no longer just a matter of quantity, which I've been talking about, which is the number of eggs that are left in the ovary. Also, the quality after the age of 37, especially, is affected, where the division of the cells is affected, where the cells need to divide and chromosomes are shared before the egg meets the sperm, where fertilization takes place. That mechanism now gets aged as well, and there's a high risk of developing or getting babies that have chromosomal effects, commonly known as Down syndrome or trisomies 18 and etc. So that's where the risk lies, not only now in quantity, but also in quality. So that is what age-related fertility decline is about. And really, when I explain eggs to women, because we do get 45-year-olds that come in and they would still want to fall pregnant, and not to say that it is completely impossible. I always tell my patients, listen, I am not God. I cannot predict that. But medically speaking, this is what we are looking at. And there are key things that we also look at sonographically and hormonally, where we take bloods and then we look at your age, and that I'm going to discuss a bit later or in our next video. What are the key things to check for when looking at fertility? But I would always make an example that eggs for a woman, it's like comparing hair to like this hair to an arm. So you see, I've got short hair. I just had a haircut last week and it was quite shorter than this, almost non-existent, almost chiscop-like. But look at my hair now. I need to go for another haircut because hair regrows. It's got a root and it regrows. Now, if anybody, God forbid, would lose an arm or lose a leg, we know those organs do not regrow unless we get aesthetics. So now eggs are more like an arm or a leg or a brain. So organs that do not regrow, but they are not like hair. So maybe for men, we can say sperm is like hair. For women, eggs are like an arm or a leg. So it's not things that would regrow. And we do not have manure, because others will be like, is there something I can take to regrow my eggs or something like that? Unfortunately, we don't have. We can only give supplements that will improve the quality of what is already in the reserves or what is already stored inside, but not to grow new eggs. So there is also a condition called primary ovarian insufficiency. Others will call it premature menopause. Others will call it primary ovarian menopause. Means the same thing. So we call it POI, primary ovarian insufficiency, which, yes, in layman's term, we can call it premature menopause. Now, this is a group of women. It affects about 1% of the population, but 1% can be 1% too much if you're part of the percentage and it's your experience. This is a group of women that actually lose their eggs before the age of 40, where the ovarian reserves get depleted before the age of 40. That's why it's called premature menopause. And there are many causes to this, and they can be surgical. If a woman loses her ovaries for any reason, it could be they undergo chemotherapy, maybe it's breast cancer, they're treating breast cancer and then they get chemotherapy for that. It could be radiation therapy, it could be due to surgery, but then commonly you find that it's not explainable. It's what we call idiopathic, where women are just born either with very few numbers. So you find that when other women are born with about 6 million eggs or 5 million eggs, or made with 6 or 5 million eggs, and born, by the time they are born, they have 1 to 2 million eggs. Others are made with 3 million eggs, for example. I'm just trying to simplify it as much as possible. Then you find that others are born with 3 million eggs. Are made with 3 million eggs. By the time that they are born, they're already left with 500,000 eggs or 300,000 eggs, which is something that most women will be having by the time of their puberty, but they are born with fewer number of eggs. By the time they reach puberty, they already have less than 25,000. So these are cases now where you find women either late in their 20s, or when they're ready, they're settled, they're married, they are 30 years old, and they're trying to conceive for a year, for 2 years, nothing is happening, and they come in and unfortunately get that diagnosis that they have depleted stores of ovarian reserves. So that is primary ovarian insufficiencies. Some of them present early, maybe at the age of 16, by not getting their periods at all, and they are behind their peers, and to be diagnosed at the age of 16 that their egg reserves have been depleted. So that is primary ovarian insufficiency. So what do we do with women that are struggling to conceive, only to find that they have a womb, they have fallopian tubes, but they are missing the actual seed, either from primary ovarian insufficiency or age-related infertility? So the option then, if the womb is fine, I relate it to, or make an example of, having a field, either to build property or to plant, have peach trees in there. So for you to have peach trees, you need seeds. And now that's what we find. The actual seed, which is what we find in the ovary, the eggs, are missing. That's when I say, look, we have to beg and borrow. You borrow from somebody you know, or you borrow from someone you don't know. So that is where egg donors come in to assist, because you've got this field, you would like to eat peaches, but you don't have the peach seed. So it's either we get a known donor, which is somebody you know, who mostly we recommend needs to be less than the ages of 32, they need to have good social habits, etc., etc. We then do tests on them. We then check their ovarian reserve and other conditions like STIs, HIV, syphilis, etc., their hormone profile. And should they be fit to donate an egg, they are qualified. They go through the process of egg harvesting. It's more like going through IVF. They do the injections on a daily basis, plus minus 12 days. And then when the follicles grow from the inside, we sedate them, we put in an injection and take out the eggs. We can get 10 eggs, we can get 15 eggs. If they have a lot of eggs or hyperstimulated, then about 15 eggs. Depending on the number of eggs, then we get the sperm either from your partner, but if you're single, then other women will get a donor egg and a donor sperm. If they have a partner, they will get their partner's sperm, fertilize these eggs, and we have babies. Now it's those babies that we take and we put in the wombs of women who are trying to conceive but do not have eggs, which are the seeds. Now, medically and legally and otherwise, that baby is yours, because you go through the pregnancy process, you go through the ups and downs and the aches and pains of pregnancy, the checkups and all of that, and you deliver that baby, be it C-section or normal vaginal delivery. Then you are the mother, the one that gives birth to that baby, and it's up to you what you share, who you share with, how much you share. So that is getting a baby from a donated egg. If it's somebody that you do not know, it means you never get to meet this person. The person gets a contract signed between them and the fertility clinic, and you get a contract signed between you and us, the fertility clinic, and then we become the mediators. And you never get to meet the donor. except if the agency that you use to get the donor gives you a profile of the donor that is anonymous, no contact details. The best you can get is a picture of the person when they are less than 10 years of age, just for you to see what kind of baby you'll be getting. Mostly you look at the complexion, the shape of the face, the height, the background history, family history, all of that. We do not usually have the genetics of the patient that, the donor that you'll be using. So then you can pick a donor online, do all the the background check that you can, that is made available for you, and then you can have your donor get the eggs and have your baby. If you are using a known donor, then you need to have a psychological checkup, yourself, your donor, and your partner. You go and see a psychologist to make sure that this person is aware of the processes that they are going through. And you need to have also an attorney that you visit, and you sign a contract, because as ifuni tori, we don't want people coming back and saying "Ifuni ingane yami nginisizile ini," when things happen, or when one partner dies, then you are in trouble and things get out of hand. So you need a legal contract, even if it's your cousin, Mtembilu Siswako, we understand, but life happens. So the person that is donating the eggs to you should be fully aware that they are donating eggs. That's it. They are not donating a baby, and it's not their baby. When the baby gets formed, it is your partner's sperm and the egg and your womb that actually forms the baby, and it becomes your baby. Okay, so those are the nitty-gritties, just generally talking about ovarian depletion and what options are there. So other options will of course be considering adoption, which then will be a process that you will be taking and going through with the social workers.